sentirá suficiente incomodidad como para ver a un médico. Pero sin embargo, estamos medicando este cambio cada vez más. La naturaleza de las cosas, con David Suzuki. Noticias calientes sobre la menopausia.
I was in the middle of teaching, and so all of a sudden I'd feel this fire going up my body, and my face would go red. It's very embarrassing. But then I looked around the room. I taught adults. I looked around the room and I saw a few women my age, and I thought, she's having a hot flash too. I guess it's all right.
We basically showed that menopause didn't cause depression. We also showed that, in fact, women's attitude to menopause was extraordinarily neutral or positive.
I don't think it's a disease. I think these symptoms, some of the more serious symptoms of the hot flashes and the sleepless nights, yes, they can be treated with hormones, and I have to admit I capitulated. I gave in after not having slept for about a year. I said, okay, I'll take it.
I do have some colleagues who feel very strongly that every woman over 50 ought to be on hormones. It's almost like they think we should put it in the drinking water like we do with fluoride.
Well, our evidence, and in fact evidence from a lot of other studies, now shows that the longer a woman uses postmenopausal hormones, the greater her risk of breast cancer.
There's a group who are vocal about it, but a lot of women are sort of like, they won't even admit their age, so they're definitely not going to admit they're going through menopause, which is a shame, because everybody goes through it slightly differently, and there's a lot to share and understand on this, and it's a totally natural process in your life, and people tend to be fighting it and not accepting it, which you have to do.
Go. 1, 2, 3, 4. 1, 2, 3. Keep the elbows up. 1, 2, 3, 4. That's nicer. Yeah. 2, 3, 4. Very good. Yeah. The more fun you have with this, the better it's going to be. All right, for all.
La difícil madurez. El momento cuando los hombres y las mujeres debemos ajustarnos física y mentalmente para envejecer. Para las mujeres, uno de esos ajustes incluye la menopausia, cuando a sus ovarios se les terminan los óvulos y ocurre una baja en dos hormonas muy importantes, el estrógeno y la progesterona. Los cambios en el estrógeno pueden causar sofocones. Las señales clásicas de la transición natural de una fase a otra de la vida. Es el momento para buscar un nuevo equilibrio en el próximo paso del viaje de la vida. Puede que la vista sea diferente, pero es igualmente fascinante. A medida que el paso de la vida se acelera y nuestros días están plagados de trabajo y preocupaciones, tendemos a depender de la ciencia como ayuda para tolerar el cambio. Olvidemos que nuestro fin fue moldeado por nuestro inicio, y durante el proceso le damos a cambios normales como la menopausia una mala reputación. Algunas culturas no se obsesionan con la osteoporosis o las enfermedades cardíacas y reciben a la menopausia como otra parte de la evolución natural de la vida. El Centro de Estudios a Largo Plazo para la Salud de la Mujer en Massachusetts encontró que hay varios mitos asociados con la menopausia. Su directora, Sonja McKinley.
I think that a myth, actually, that is a current myth, is that at the point that a woman reaches menopause, she literally falls over a precipice into old age. There is a lack of appreciation in women that aging is a gradual process, as it is in every other living being, and that just because she loses her estrogen, or she doesn't lose it, it just declines to a lower level, that suddenly she is magically old. And people are forgetting that she still has half her adult life to live. People assume that everything attributable to aging is in fact attributable to menopause. Osteoporosis, and heart disease, and now it's Alzheimer's is the newest fad.
En nuestra sociedad, la edad promedio para la menopausia es 51 años, pero cualquier momento entre los 40 y los 59 años puede considerarse normal. Los estudios de McKinley desarraigaron el mito de que la menopausia causa depresión y hallaron que las mujeres pasan poco tiempo lamentándose de sus nidos vacíos. Que las mujeres no deberían sobrevivir a sus ovarios es otro mito que McKinley quisiera eliminar.
People always assume that because a life expectancy was once 50, nobody lived beyond 50. All that means is the average age at which people die is 50. Women lived beyond 50 back in Greek and Roman times and in medieval times, and in fact from available documentation, some historians very interestingly estimated that the average age at menopause for those women was, guess what, about 50.
En el pasado, innumerables mujeres morían en el proceso de dar a luz. Mientras tanto, niños y niñas morían de enfermedades comunes en la niñez. Pero sobrevivir a una vejez tranquila no era inusual. La autora Barbara Seaman.
The purpose of menopause is a very fine evolutionary one. The human species, unlike most of the mammal species, has a very long childhood and adolescence and so on, so that it really isn't advisable for a woman to bear children shortly before she dies, if that can be avoided. And therefore, as part of the evolution that made us human, menopause, the goddess created menopause so that a mother would live at least another 20 years after the birth of her last child. In other words, the lifespan, according to the Bible, was 70 years, 70. Menopause occurs around the age 50. And hopefully, by the time a person's youngest child is 20, she or he is ready to live on her or his own.
El empleo extensivo de las hormonas preocupa a Barbara Seaman, quien piensa que la investigación sobre sus riesgos con frecuencia no es totalmente difundida, sino reservada. Durante los años 60, ella alertó sobre los riesgos que ocasionaban las pastillas anticonceptivas que contienen formas sintéticas de estrógeno y progesterona. Su libro originó una serie de audiencias en el Senado que resultaron en dosis más bajas y folletos informativos dentro de cada empaque. El estrógeno se sintetizó en los años 30 y para la Segunda Guerra Mundial se había convertido en una droga para la investigación de enfermedades. Desde 1941, como dietilestilbestrol o DES, fue ampliamente recetado para prevenir abortos espontáneos. Cuando terminó la guerra, el estrógeno para los síntomas menopáusicos ganó popularidad. Mientras los hombres estaban en la guerra, muchas mujeres trabajaban fuera de sus hogares, lo cual las hizo percatarse de su propia fortaleza y potencial. Con el regreso de las tropas, un sueño doméstico se apoderó de la población, reemplazando la pesadilla de la guerra. Ser una madre y ama de casa era visto como la meta ideal para una mujer. Cuando los hijos crecieron y abandonaron el hogar, desapareció el supuesto propósito de la vida de la mujer y muchas reportaron síntomas de depresión. El estereotipo surgió en los avisos farmacéuticos. La perdida mujer de edad mediana. Como lo dijo un experto, había sido castrada, víctima de una vida en descomposición. El experto había sido Robert Wilson, un prominente médico de Nueva York, quien firmemente estableció la menopausia como una enfermedad causada por la falta de estrógeno. ¿La cura? Largos periodos con hormonas para las mujeres inestables con necesidad de estrógeno.
He seemed to really have an aversion to aging women. It was very funny. He said if a woman takes estrogen, then even at 50 she can still look pretty nice in a tennis costume. And of course, we think it's the tennis that does it. There's never been any evidence that, that hormones actually make a woman look younger.
El bestseller de 1966 de Wilson alegaba que las hormonas mantendrían siempre femenina a la mujer, pero guardó silencio sobre el $1.000.000 que había recibido para promover el estrógeno. Las ventas aumentaron, pero en 1971 ya existían dudas. El DES, recetado para prevenir los abortos espontáneos, estaba causando problemas reproductivos en los hijos de las madres que lo tomaban. En 1975, se confirmó el vínculo entre el estrógeno de la menopausia y el cáncer de endometrio. Las ventas se derrumbaron y comenzó una búsqueda frenética para hacer más seguro al estrógeno.
Usted está por Calientes sobre la menopausia.
Los científicos encontraron que combinando el estrógeno con una progesterona sintética podían imitar el ciclo menstrual natural de las mujeres al hacer que se restableciera un sangramiento mensual y reducir así el riesgo del cáncer de endometrio, que es el cáncer del recubrimiento del útero. La terapia de reemplazo de hormonas es hoy una de las drogas más vendidas en Estados Unidos y se recomienda para reducir el riesgo de enfermedades cardíacas y osteoporosis. Para la mayoría de las mujeres, no existen dudas de que la terapia de reemplazo de hormonas controla los síntomas menopáusicos, sofocones, sudoraciones nocturnas, resequedad vaginal y problemas menstruales. Su uso continuo hasta por 5 años parece ser seguro, pero su uso a largo plazo aún se desconoce. Isaac Schiff fundó una de las primeras clínicas para la menopausia en Estados Unidos. Como jefe de ginecología en el Hospital General de Massachusetts, en Boston, fue el primero que alertó sobre los peligros del DES. Pero Schiff mantiene la mente abierta sobre la terapia de reemplazo de hormonas.
Now, if you had to do it and sort of measure it out by numbers, there is no question that there would be many more lives saved by taking estrogens, because heart disease is the #1 killer of women. You'd prevent osteoporosis-related fractures. So there's no question that taking estrogens would save many more lives. However, it's a very personal decision, and I, as a healthcare provider, can't make that decision for my patient. She has to decide whether or not taking estrogens is worth any slight increase in breast cancer. And what the woman's really faced with, if you think about it, is taking an estrogen at age 50 to prevent a hip fracture at age 80 or a heart attack at age 77, which might increase her risk for breast cancer at age 60.
This drug is a fashionable drug. It's like, it almost has the aura of a magic bullet. It's going to solve all women's problems. If we just keep giving women hormones, it will solve all their problems. But data, I think, will begin to emerge which are increasingly going to show that hormone therapy isn't the panacea for all of these conditions, and in fact may be causing some very problematic side effects. The biology of these relationships is not well understood, and in fact hasn't even been well researched, specifically for cardiovascular disease and Alzheimer's. And it's not clear that there is a clear biological relationship between decline in estrogen and susceptibility to these diseases, conditions that are seen in men as well as in women, and in men are quite happily associated with aging. So why it shouldn't be aging in women, I don't know.
Puede que algunos estudios sobre la terapia de reemplazo hormonal estuvieran parcializados.
We have to be very careful how we interpret that estrogens prevent heart disease. Most of the information we have is gained from reading studies, looking at the outcomes of women who took estrogens. Not only do we have the bias of the women who seek hormone replacement therapy, but we have the bias of the physicians themselves. When we go back to the 1980s, a woman comes into your office, you're a very busy practitioner in downtown Boston, and a woman comes into your office and she says to you, look, I have these hot flashes. And you look at her, and she's a little overweight. She is pre-diabetic. You know that her father died at 60 of a stroke. Her mother died at 65 of a heart attack. And she's overweight with a borderline blood pressure. You look at her, you're a busy doctor, the last thing you want to do is get sued. You know that she's sitting on a time bomb. She's bound to get one of those medical illnesses that's going on. That's what your clinical intuition tells you. So you'll look at her and you say, you know, hot flashes never really killed anybody. Why don't you wait a few months, call me, and we'll talk about it again. And she says, whatever you say, doctor, and she goes out. And then the next woman comes into your office, and she's 50 years old. She's got her tennis outfit on, and she says, you know, doctor, I have these damn hot flashes. Could you please give me a prescription for estrogens and make it fast? My parents are in their 80s. They're flying in from Arizona. I'm taking them out to eat, and then we're going out to the theater. And you can't write that prescription fast enough. And then you wait about 10 years, and somebody smart from one of the medical schools in Boston comes to your office and tells you they're getting a PhD on estrogens and what it does to a woman's health. They ask, would you mind if I review your medical records? You say, by all means, and you don't have to be a genius to figure out that the women who took estrogens are going to live longer and have less disease because the doctors gave estrogens to the healthier patients in the first place. And now we're telling everybody to take estrogen replacement therapy. We could get into a lot of trouble because it might, after all, just be one grand experiment without accurate data, and we have a whole generation of women rushing to take estrogens. Do I prescribe estrogens? Absolutely. Many of my patients are helped dramatically, but I also tell them we don't have enough information.
En este apacible pueblo de Nueva Inglaterra se han investigado durante años los secretos del corazón humano. Fundado en 1948, el Centro Framingham para Estudios del Corazón fue uno de los primeros en su tipo en incluir mujeres. Impulsados por lo que parecía ser una epidemia de enfermedades cardíacas, los médicos reclutaron al azar a más de 5,000 residentes. Gradualmente, esta observación a largo plazo se extendió para incluir a miembros familiares de los participantes originales. Margaret Sherman tenía 30 años cuando se unió al grupo. Hoy, su hijo y su esposa también se han unido, al igual que su hija Nancy.
Was stolen out of his car. Did he get it? And you won't believe it. I just forgot to tell you, Mother. Wow. It's wonderful.
El director original del Centro Framingham era William Cannell.
Women are tougher than men. They live longer, and they have a lower mortality from virtually every disease than do men, with the exception, of course, of breast cancer and uterine cancers. So it's important to recognize that women do develop a lot of illnesses which they survive better than men.
You had to be 30 years old to get into it. And some friend asked if I'd like to be a volunteer, and I went along with it, and it's been wonderful.
Sociable, extrovertida y activa, Margaret se casó cuando tenía 25 años y crió 3 hijos antes de volver a trabajar. Al igual que 1/3 de las mujeres estadounidenses, se sometió a una histerectomía, pero excepcionalmente no le hizo la menopausia más difícil. Después de morir su esposo, se dedicó a viajar y aprendió a jugar golf. Hoy, a los 87 años, todavía disfruta de la vida. Como miembro del Centro de Estudios del Corazón, Margaret se somete a una revisión completa cada 2 años. Las mujeres tienen una ventaja de 20 años sobre los hombres en cuanto al riesgo de ataques cardíacos. Los médicos sospechan que hasta cierta edad el sistema reproductor femenino juega un importante papel de protección.
Well, after women undergo the menopause, they then become more susceptible to coronary disease and to the more serious forms of coronary disease like heart attacks. The male to female ratio of coronary disease and coronary mortality does diminish progressively with advancing age. And in advanced age, it approaches that of men, but never quite equals it.
How are you? Nice seeing you again. Again, after all these
En la revisión se incluye una densitometría ósea. Margaret jamás ha tomado hormonas y no sufre de osteoporosis.
All right. Like your birthday, please? 10-15-09. 10-15-09. Okay, we're going to scan your...
Cuando la mujer se encuentra entre los 30 y 40 años, ya ha comenzado a perder masa ósea. Una pérdida que se acelera al llegar a la menopausia y se hace más lenta unos 5 años después. La baja densidad ósea es un factor de riesgo mayor para la osteoporosis o huesos quebradizos. Los médicos de Framingham creen que existen evidencias de que la terapia de reemplazo de hormonas puede reducir la pérdida de masa ósea en las personas que corren ese riesgo. También insisten en la importancia de una dieta saludable acompañada de ejercicio.
I think you're a very active lady, so you're going to be answering yes to all these. And now, over the past 7 days, how often did you take a walk outside your home or yard for any reason? For fun or exercise, walking the dog, or walking in a mall? 1 to 2 days last week? 3 to 4? 5 to 7? Or none? 3. Okay. Over the past 7 days, how often did you engage in moderate sport and recreational activities, such as doubles tennis, ballroom dancing, hunting? You didn't go hunting last week? No?
You did get my age.
Oh, try to keep your neck still.
That's right.
Okay.
¿Podrá la terapia de reemplazo de hormonas disminuir el riesgo de enfermedades cardíacas en la mujer? ¿Y cuán seguro es su uso a largo plazo? El director del Centro Framingham para Estudios del Corazón, Daniel Leaf.
I'd say we simply don't have all the answers. We have some. We know they'll benefit in terms of osteoporosis risk. We suspect they may benefit in terms of improving cholesterol levels and possibly lowering coronary disease risk. But the extent of harm in terms of cancer risk is something that we don't fully understand yet. So right now, informed decisions are being made on limited scientific information. In the near future, the informed decisions will be made on a much larger universe of information.
Quizás esa información ayude a las nietas de Margaret cuando lleguen a la adultez.
Gonna be a good soccer player. I think so.
Nancy decidió no someterse a la terapia de reemplazo de hormonas. No es una decisión fácil. Muchas mujeres se sienten culpables si la toman y otras si no lo hacen. Pero cada vez más mujeres de mediana edad se sienten obligadas a tomar píldoras para problemas que aún no tienen. Kathleen McPherson, profesora de enfermería de la Universidad del Sur de Maine.
In public health, there's a saying, you don't use medicine on a grand scale to a healthy population. And that's really the basis. Because there are risks involved. I mean, there's serious risks of breast cancer and so on. So we're putting healthy people at risk for a serious disease and maybe some other side effects that aren't so great for this medication that actually isn't absolutely necessary, and the women aren't ill. An analogy would be taking high blood pressure pills and giving them to everyone to prevent high blood pressure when you don't have high blood pressure.
Los efectos de la terapia de reemplazo de hormonas también se monitorean en la cercana ciudad de Boston, donde el Centro de Estudios de Enfermería le ha hecho el seguimiento a más de 100,000 enfermeras desde 1976. Graham Colditz es codirector del centro.
Our evidence now shows that the longer a woman uses postmenopausal hormones, the greater her risk of breast cancer. We're struggling to have enough data on this because, in fact, not a lot of women have taken hormones for 10 and 20 years into their 70s and 80s, and our predictions are that we'll see even bigger increases in risk of breast cancer as we have women taking hormones for that duration into those ages. I think we have to look seriously at why hormones are used and what our goals are in long-term use. For relief of menopausal symptoms, they probably are the unarguable choice. For prevention of heart disease, there are many options that don't require the same medicalization. Physical activity, avoiding obesity, aspirin, vitamin E. So yes, there are pressures and marketing, and the drug industry is a billion-dollar industry just around postmenopausal hormones. But I think in the process of marketing, we probably have underemphasized the adverse effects here. that include increased risk of endometrial cancer and increased risk of breast cancer.
Contraer osteoporosis.
I was in Paris and some man tried to steal my purse, some young guy, and I chased him and got into a fight, got my purse back, but I had a broken arm. I came back to Toronto and I have a wonderful doctor and they rushed me to emergency and the x-ray and they found that I had low bone density. And that's was the start of it. So I had a bone density test and that's when they found out that I have osteoporosis.
Después de los 50 años, una de cada 4 mujeres es vulnerable a la pérdida de densidad ósea. Dicho de otra manera, el 75% de las mujeres en edad mediana no corren este riesgo.
I should have known, because I never drank milk. I hated cheese. When all the kids lined up for ice cream, I was never an ice cream person, so dairy products I've never ate. Early menopause, all the signs, everything was a sign, like small, boned, fair, everything was against me.
Osteoporosis is more common in older women, but it's also more common in older men who don't have menopause. I think if we go back to the notion that industrialization has changed our lifestyles enormously, some of it translating to earlier age at menarche, we've also taken away an enormous amount of physical activity through our industrialization. And in so doing, we put far less work on our bones and do less to maintain muscle mass.
Los cambios recientes en una hermosa iglesia barroca en Inglaterra demostraron cómo se han alterado nuestros huesos a través del tiempo. La iglesia de Cristo en Spitalfields, en el este de Londres, donde más de 1000 cuerpos fueron enterrados durante los siglos XVIII y XIX.
The lead coffin weighs about a quarter of a ton. If you imagine the problems we had dragging them out of here.
Cuando las autoridades eclesiásticas decidieron limpiar la cripta, se exhumaron los cuerpos y fueron examinados por arqueólogos que encontraron en las bóvedas cientos de féretros apilados uno encima del otro. Las placas inscritas con nombres y edades de los féretros permitieron una investigación más profunda de los muertos. Muchos habían trabajado largas horas hilando seda en Spitalfields. Esta mujer de 77 años fue una de tantas cuyos restos fueron sometidos a exámenes de densidad ósea. Los secretos que revelaron tomaron por sorpresa a los científicos. Estos viejos huesos eran mucho más fuertes, tenían menos pérdida de densidad ósea antes y después de la menopausia que los huesos de las mujeres modernas. El estudio que comparó a mujeres vivas de la misma edad nos lleva a preguntarnos por qué las mujeres de hoy están perdiendo densidad ósea más rápidamente. El cigarrillo pareciera ser un factor que puede acelerar la menopausia. Demasiada cafeína o alcohol, o demasiadas histerectomías, pero el principal culpable parece ser una reducción general de actividad física.
From the time I started working, I used to wear 6-inch heels, so you couldn't do a lot of exercise in those sort of heels. I mean, we all walked around our tippy toes, and you got a bus here, and you never thought of walking in those days. It wasn't sort of something ladies did.
What's the word that describes what's happening scientifically when I do this? Friction. Friction. Right?
La clave del problema puede estar en la infancia. La actividad de los niños disminuye en cuanto comienzan a ir a la escuela. Las horas sentados en un pupitre frente a una computadora o viendo televisión señalan que los hábitos sedentarios se han convertido en la norma. Los huesos en crecimiento de cientos de niños están siendo escrutados en la Universidad de Saskatchewan. Los estudios de huesos durante 6 años miden el impacto del ejercicio, la dieta y la herencia. Al igual que la piel, las células óseas se forman constantemente, se absorben y son desechadas. El equilibrio entre la pérdida y la formación es lo que define la fortaleza de nuestros huesos. Durante los 2 años, antes o después de la pubertad, los huesos de los niños pueden acumular grandes cantidades de minerales óseos. En las niñas, la oportunidad vital ocurre entre los 10 y los 14 años. En los varones, entre los 12 y los 16 años. Don Bailey fundó este centro de estudios.
During the 4 adolescent years, a child will lay down approximately 35 to 40% of their total adult bone mineral. Now, this represents as much bone mineral as many women will lose in their whole adult lifetime. So that's why I say this is an absolute crucial period.
And what was in the macaroni salad? Carrots, onions, celery, and mayonnaise. And mayonnaise and the dressing?
Es el primer estudio en el mundo que lleva un control de los niños durante sus años de crecimiento, vigilando cuidadosamente su dieta y sus huesos.
That amount. Regan, we'll just go over yours a little bit. Were they homemade cookies? Yeah. And what kind were they? Chocolate chip oatmeal. Okay.
There's this tremendous societal drive in North America, at least, and I think in a lot of the Western world, towards thinness. And as a result, this impacts upon nutritional intake, and a lot of girls are substituting high calcium dairy products with high phosphorus level diet soft drinks, for instance.
El fósforo consume el calcio de los huesos, pero irónicamente, en el momento que más necesitan calcio, muchos adolescentes parecen evitarlo. Lo mismo sucede con el ejercicio, pero como dicen los suecos, durante la primavera nadie piensa en la nieve que va a caer.
It's a universal law of human biology that we all lose bone mineral as we grow older. So it just makes logical and biological sense that the more bone mineral that you can acquire during the growing years, during the years when you can, if you will, make deposits into this bone account, that it will stand you in better stead when you start making withdrawals as an adult.
Los niños que formaron huesos fuertes durante la adolescencia quizás sean menos propensos a fracturarse cuando sean mayores, pero podríamos adoptar otra posición. Podríamos dejar de culpar a los huesos quebradizos de la menopausia. Una cuarta parte de las caderas fracturadas en Estados Unidos pertenecen a hombres, y dedicarnos a formar huesos más resistentes desde la infancia, fortaleciéndolos y vigorizándolos en lugar de depender de las medicinas.
The protection a woman has while taking hormones is only there while she's taking hormones. So if we're really going to use HRT to reduce risk of osteoporotic fractures, we need to use them for life. The consequence of that on breast cancer risk, I believe, is quite substantial. There are really quite neat randomized trials that show if you take 70-year-olds and older and put them in an exercise program, their risk of hip fracture is drastically reduced because they build better muscle tone, and so they're less likely to fall. And if you don't fall, you're less likely to fracture a hip. So seeking a straight medical drug approach is really sort of the easy way out for some, but it's missing the broader social causes of osteoporosis, and it's really not working to counter the inactivity that is contributing to this problem in Western society.
De Chichimila, en la península de Yucatán, las mujeres bailan a otro son. También lo hace Youd Darbellene, originaria de Etiopía, quien vino aquí a estudiar las vidas reproductivas de las campesinas. A esta doctora, graduada en antropología en Estados Unidos, le intrigaba la actitud negativa de este país hacia la menopausia y se preguntaba cómo reaccionaban las mujeres mayas.
I had an assumption before I came. The assumption being one of the things that I was curious about was since menopause is universal in terms of the cessation of the menses being universal for women after they finish their reproductive years, I thought I'll be able to find what it means to them, what it signifies culturally. And I thought, if this is a universal experience, they should have some kind of universal physiological symptoms. I thought, I'll find hot flashes, and I'll find out what they do to relieve the symptom. No culture puts up with uncomfortable symptoms.
Yeubdar penetró en la vida de la aldea aprendiendo a cocinar tortillas y ganándose la confianza de las mujeres.
Empecé a aprender, pero...
Según nuestras normas, aquí las mujeres experimentan antes la menopausia a una edad promedio de 42 años, pero puede ocurrir hasta los 33 años.
Foto de esto. Ya está.
Desde los 7 años, las niñas aprenden las responsabilidades domésticas. Se casan poco después de comenzar a menstruar, alrededor de los 13 o 14 años, y pasarán el resto de sus años fértiles encinta o amamantando. Esta cultura tradicional del campo, con su alta tasa de nacimientos y su lento ritmo de vida, puede ser el de más fácil adaptación para los genes humanos.
Cosas. Noticias calientes sobre la menopausia.
Alfonsa tenía 41 años cuando comenzó su menopausia.
¿Esto pasó?
Pues yo no tuve molestias, me sentí bien, de repente así como normalmente veía mi pelo, después 2 meses, un poco más, ya.
Ya entonces terminó. Ajá. Y después de esto, ¿se sintió mal?
Pues,
¿No? ¿Nada?
No tuve dolor de cabeza, no tuve nada, sino que me sentí bien. No tuve molestias.
Y aquí, para las mujeres, cuando dejan sus reglas, ¿qué significa para ellos?
Pues
la costumbre.
Como una costumbre de que como andan como una niña, como ya no tiene ninguna molestia, ya no tiene por qué arreglar, ya no tiene por qué tener hijos, ya los hijos que tiene sí, y andan como siempre, sin ninguna molestia. Andan normalmente como niñas.
They really did not complain about hot flashes. I asked, actually, to the point where somebody said to me, "Are you trying to tell us that there is a disease? Do we have to worry about?" And that's when I really stopped, because I was really bringing an outside issue of forcing them to tell me something that was not there.
Liberadas de la menstruación que conlleva tantos tabúes, las mujeres mayas reciben la menopausia con alivio. Como miembros mayores y productivos de la sociedad, han ganado el respeto y una cierta cantidad de poder, y ya no deben sufrir el estrés ni los peligros del embarazo y el parto. Pero la nueva libertad de hacer el amor con sus esposos sin la preocupación del embarazo y una mejor posición social no explica la falta de sofocones. La prolongada amamantación puede ser un factor importante. Cuando una mujer amamanta, se le inhibe la ovulación y consecuentemente la producción de estrógeno.
For the Mayan, getting married at a very early age, having children every few years, breastfeeding for 2 years, and not having their period back for about 18 months makes a different level of exposure to estrogen. Actually, they seem to get a lot more breaks from being exposed to estrogen. Versus for modern Western women, where they have from about 37 years of reproductive years, 35 of it having a cyclical pattern where they are being exposed to estrogen consistently, and not having children, maybe 1 or 2, not breastfeeding, having, even for those who have children, getting back to ovulating very early, because that's also related to diet. And one wonders, what does it mean to be exposed to this much estrogen? And especially when we add to that, to the, in addition, having birth control pills and estrogen pills later on, what really does it do to the body? You know, why are we tinkering with this biological clock?
bajo estrógeno, menopausia temprana, y sin embargo no existe la osteoporosis. La dieta maya es rica en calcio. Lo adquieren bebiendo agua de una tierra cálcica y del maíz para las tortillas que remojan con esa misma agua. Y todo el día hacen trabajar a sus huesos y a sus músculos. A pesar de tener poca densidad ósea, sus fuertes extremidades los llevan hasta la vejez y las fracturas son prácticamente desconocidas.
I don't think the Western society is really going the right way about resolving the issue around osteoporosis. When a woman reaches menopause, the body is saying, I don't want any more estrogen. And what we're doing is actually adding something that the body does not want. And I think there's a lot more consequence that we don't know in the future resulting from this issue. I feel maybe the best way will be to encourage women to change their sedentary lifestyle, to encourage younger women to eat right, to exercise, to really watch it right from the beginning, because this is a lifelong process. It's not something that we can treat only after menopause. It has to be from beginning to end.
If we realize what a gift this period of life is from 50 or 60 onward, we'll make much more effort to make the conditions good, make our health better. Right now we think of it as a kind of decline or retirement or, and it is in fact an exciting period of life, just as exciting as it is to be an adolescent after you've been a child or, a 20-year-old after you've been a teenager. So we need to realize its potential before we are going to put the effort into saving that potential.
I'm perfectly happy to be who I am. I'm perfectly delighted with every single bloody wrinkle on my face because I earned it. And I earned it, and I paid for it, and I paid my dues, and I think I'm a better person today than I was 20 years ago. So, it's on menopause. Who cares?
I revel in being a grandmother now. I just love it. I think for many women, it's the happiest period in their lives. It's their reward for a life well lived.
I never feel miserable. There seems to be a joy beyond me. It's a bit like the experience people have when they use mescaline, except I'm not using mescaline. And I don't know what to call it, so I call it soul. It's as if soul was clapping its hands and singing, and wild is singing for every tatter in my mortal breast.
I'm having a good time. Please don't blame me. I'm knocking myself out. Don't try to tame me. Let me have my fun. I've got to have my fling. Some folks say I'm blowing my top, but talk don't mean a thing. I'm playing it cool while I'm living, 'cause tomorrow I may die. That's why I'm having a convention today, and I ain't passing nothing by. So if I make my bed hard, that's my problem. Let me lay. I'm having a good time living my life today. Come on, folks, join me. I said I'm playing it cool while I'm living, 'cause tomorrow I may die. That's why I'm having my fun today, and I ain't passing nothing by. So if I make my bed hard, my problem, let me lay. I'm having a good time living my life today. Yeah, thank you.